This is our group's basic journal presentation about Journal of Dental Education by Dr. Reem, Zakri and Dr. Afnan al-Mzyed. The Journal of Dental Education is a peer-reviewed journal that publishes a wide variety of educational and scientific research in dental, allied dental, and advanced dental education. The publisher it's published continuously by the American Dental Education Association since 1936 and internationally recognized as the premier journal for academic dentistry. The Journal of Dental Education publishes articles on such topics as curriculum reform, education research methods, innovative educational and assessment methodologies, faculty development, community-based dental education, student recruitment and admissions, professional and educational ethics, dental education around the world, and systemic reviews of educational interests. The Journal of Dental Education is one of the top scholarly journals publishing the most important work in oral health educational today. It celebrates its 75th anniversary in 2011. The frequency is monthly. The 5-year impact factor 1.22. Subscription for American Dental Education Association member $80 for print version. Online access is free. For non-members from US $160, from Canada $190, for foreign $220. The editorial staff: Dr. Nadim Karim Bucks, the editor. The editorial staff: Dr. Marita, Miss Sarah Brustein, Miss Virginia Bader, Miss Judy Myers, Dr. Lane Page Wattaker. The editorial review boards: Dr. Cynthia, Dr. Lisa, Dr. David, Dr. Sharon, Dr. Wee Shaolin. The contact information: American Dental Education Association in Washington, D.C. The article we chose: Factors Influencing Dental Students' Specialty Choice, a survey of 10 graduating classes at one institution. The authors: Jane Shin, DMD, a periodontics resident, Columbia University College of Dental Medicine; Taru Kinnanen, PhD, Assistant Professor, Department of Oral Health Policy and Epidemiology, Harvard School of Dental Medicine; Dr. Marisa Zarki, DMD, practicing endodontist in Lansdale, Philadelphia; Dr. John Da Silva, Dr. Brian Mayong Chang, Dr. Robert Wright. Enrollment in U.S. advanced dental education programs has increased each year. However, an increase in application rate was observed in only some dental disciplines. While endodontics and orthodontics saw a decline in applications per program, dental, public health, oral and maxillofacial surgery, pediatric dentistry, periodontics, and prosthodontics experienced increases. Very few studies have looked at the reasons dental graduates decide to pursue certain disciplines in dentistry over others. A pilot study conducted at Harvard School of Dental Medicine found that the factors that most influenced students' decisions to select a particular dental field are: possessing special skills, talent unique to a specialty, intellectual content of the specialty, challenging diagnostic problems. Factors such as future income in the specialty, dollar value of specialty training, the public's demand for additional training in dental providers, and advances in the field contributed to the rise in applicants to prosthodontic specialty programs. The aim of this study was to examine students' specialty choice and the factors that influenced that choice for 10 graduating classes at Harvard School of Dental Medicine. The authors surveyed the Harvard School of Dental Medicine classes of 2012 to 2016 and compared their response with dates from their prior survey of the classes from 2007 to 2011. Materials and methods. In 2013, the survey used in authors' previous publications was sent to all 176 currently enrolled students, classes of 2013 to 2016, and recent graduates, class of 2012 of Harvard School of Dental Medicine. Internet-based survey program Key Survey was used to distribute and process completed survey. The respondents completed the survey anonymously and voluntarily. Respondents were allowed to skip answers as they wished. Respondent information collected on the survey included class year, gender, age group, years between college and dental school, amount of debt expected to be accrued by the end of dental school. Survey questions were designed to generate information regarding student specialty choice and factors that influence specialty choice. Statistical analysis was carried out in Statistica. Raw data were directly extracted from the Key Survey database. Results: the response rate was 81%. The majority, 94% of respondents, were between the age of 20 and 29 years. The female-to-male ratio was 1.5 to 1. These figures were very similar to those from respondents in the classes of 2007 to 2011. The specialty choice and influencing factors. Most respondents has made their decisions during the third year of dental school. A statistically significant increase in the percentage of undecided students from the classes of 2007 to 2011 to the classes of 2012 to 2016. P-value 0.003. The greatest percentage of respondents in both study groups ranked enjoyment of providing that type of specialty service as the factor that most influenced their choice. After this were types of patients seen in the specialty of service and future salary as a professional specialist.
Discussion. Harvard School of Dental Medicine is a suitable institution to study the factor that influence dental student specialty choice because a large percentage of Harvard School of Dental Medicine graduate plan to pursue advanced education in the one of the 9 ADA recognized dental specialty. Financial factor, orthodontist and oral maxillofacial surgery were the two most popular specialty and have a highest average salary. Program length was factor that was more important to response pursuing general and pediatric dentistry and according to the American Dental Association, GPR and AEGD, dental public health and pediatric dentistry have the shortest program length. Clinical care factor. The factor that influences the greatest percentage of total students was enjoyment of providing the type of specialty service. mentoring factor. Most of the exposed to the field is through others who do provide this specialty service. Usually role a model such as facility or the resident in the postgrad program at the school. Highest percentage of students pursuing orthodontists who reported being influenced by the facility than the student pursuing general dentistry. Limitation: only external factor that influenced student specialty choice was examined, but internal factors such as student personality type, gender, race could also influence career choice. The finding cannot be generalized to other dental schools because the study took place at only one school. Conclusion: enjoyment of providing the type of specialty service was by far the most important influence factor in these student specialty choice. The increase was so in unchoiced student highlight opportunities for a dental school to expand mentoring efforts by facility and clinician of dental specialties. Mentoring can lead to increased awareness of patient experience for specialty treatment and its outcome. Such experience can help a student make a career decision based on personal interest in the specialty instead of the financial burdens they face among graduation. Reference: total 18 reference, 8 Journal of Dental Education, 4 American Dental Association, 1 Journal of American College Dentist, 1 Academic Medicine, 1 Journal of Prosthodontics, 1 American Dental Education Association, 1 Journal of Canadian Dental Association.